Hey guys, welcome and welcome back to the channel. If you're new here, my name is Rosemond. Don't forget to like, comment, share, and subscribe to the channel. Today's video, I will be going over some clinical tools that you need to know as a nurse. So if you're a new nurse or new grad nurse, stay tuned for the video so you can see the equipment or tools that I will be sharing with you guys. The first thing I want to show you is a Vitals Plus machine, which is a blood pressure machine. You will scan your badge, you will scan your patient's armband, and you will connect it to your patient's blood pressure cuff, and you will apply the sensor into your patient's finger, so you'll be able to monitor your patient's blood pressure, the pulse, the oxygen saturation, and it also has a thermometer where you can take your patient's temperature, and everything will be able to be sent directly into your patient's chart because it is connected into the system that we use. This is a suction or a vacuum for your patients that need suctioning, such as your patients that have trach, or if you have a patient that has an NG tube and you need to suction any content out, so you will connect it into the suction wall, and this is your canister that the content will go into. And you can also use the same method if you have a patient that is incontinent and you need to connect a Puric into the suction, and I will show you what a Puric look like on the next clip. This is an NG tube and this is a 16 French. There are different sizes, and this one is an 18. That's for your patient that needs a nasogastric tube, and this is what an NG tube looks like. This is your flow meter. This is for your oxygen. Let's say your patient is on nasal cannula 2 liters, so you will move it up to 2, or if it's 4, you move it up to 4, and so on. So the bottom part, the pointy part, is called a tree, and that's where you will connect the tubing of your patient's cannula in order to receive the oxygen. This is a Hoyer lift. This is for your patients that are not able to get out of bed by themselves. They are pretty much total care, so if you need to weigh that patient, or you need to move the patient from bed to the chair, or from chair to the bed, so that is a very good equipment for you to use in order to move that patient around. This is your Incentivespirometer. This is for your patients that are post-op, your patient that had surgery. So when they come up to the floor, you want to make sure that you show them how to use it. You give it to them, you show them the instruction on how to use it. That is to help expand their lungs and to prevent pneumonia. So very important that they use it. Please make sure you show your patients how to use the Incentivespirometer, especially post-operatively. This is your IV pole and also your IV pump. That is for your patients that needs to get IV fluid, or if they need to get any type of IV antibiotics. So you would use the IV pole to hang your bag and connect it to your IV pump. This is your IV starter kit to start your patient's IV. You have your needles. There are different sizes. You have your 20 gauge, which is the pink one. You have your 22, which is the blue one, and you also have your H18, which is a green color needle. The higher your number, the smaller your needle is. Okay, so you're gonna need your connector, you're gonna need your extension, so you can flush your line once you put your IV into your patient. So those are the things that you'll need if you have to start your patient's IV. You will need those things. This is your Posie alarm. That's for your patients that are high risk for fall. So you want to make sure you connect your pad. This is the pad you will connect to the machine, so that if your patient is getting out of bed, it will ring so that someone can go in to prevent patient from falling. This is your Acute machine. This is to check your patient's blood sugar. It varies depending on the facility. So that's the machine you will use. You have your strips. You have your glucose liquid. That's to check for quality control before you start your Acute. Different facilities have different protocols, where some may be every shift you need to do a quality control. Okay, so those are the two liquids you would use to do your quality control before you do your patient's Acute. This is your sharp container that is to dispose of your needles and your syringes. So anything sharp will go in there after sticking your patient. That's where you would put that, and there is an outside company that comes that removes it, and they put a new one. I hope you guys enjoyed this video, and I hope that it was informative for some of you. So do not forget to like, comment, and subscribe to the channel. There will be more content coming, so let's push the video. Let's subscribe to the channel, and thank you for watching, and I will see you guys in the next video.